Welcome to the Digital Health Innovations for Long Life podcast, also named as DIL with a 4 in the middle. Today we are talking to Mr. Mayank, who works with healthcare consulting. I think it's best to know about his work and about himself directly asking him. So, welcome to our podcast, Mr. Mayank. We will start all the way from the beginning. When and where were you born, and then slowly trace your career, and then go to digital health somewhere in the middle. So, thanks for joining us. If we can start with knowing when and where were you born, that would be fantastic.
Sure. Thank you, Dr. Suresh. It is good to be here. So, about me, I am based out of Ranchi, born and brought up in Ranchi, initial days till class 12, and completed my schooling totally in CBSC, DAV Kapil Dev, and that is where my childhood. I grew up till class 12th in Ranchi, and then I went for my engineering to Bangalore. That yeah, that is the starting phase of what I remember. It's been long that I have left Ranchi now. It's been nearly, I think, 20 years easily. So
Wow.
not much memory, but initial days of Ranchi has what made me the human what I am. The learning from there, especially right now as I am in healthcare domain, I have seen a lot being a tier 3 city and then now converting to tier 2. So like rural urban mix. So that is where I learned my early days of knowledge of healthcare.
Uh, I think maybe slightly I might be bad in geography, but Ranchi is in Jharkhand, right?
Yes, correct. So
Oh,
it was not so famous until Dhoni came up from there. So and yeah, it suddenly popped up all over world and came to know. Else it was not so big city.
the reason is I always get confused between Jharkhand and Chhattisgarh.
Yes.
I've been to
Okay.
Ranchi, but I have not been to Chhattisgarh actually. And from
Correct.
Ranchi, I think we drove to Hazaribagh. There is a,
Ah, yes.
I think there's a Coal India plant there.
Yes,
So
yes.
I think I
Yep.
was giving a lecture somewhere at that time.
Got
And
it.
it's a new state, but I think Jharkhand has now fantastic roads around and a lot of good tourist spots also.
Yeah. It is a great tourist spot. A lot of falls nearby, so good place to visit to if you want to see the nature. So yeah.
Yeah. Well, I think we have also driven through Ranchi, but from the Bengal side, when we are actually going to Bihar. So I think from Bengal through Jharkhand and then to Bihar. So
Yeah. Yeah.
where did you do your college then?
So I did my college a place near Shimoga, near Bangalore. So it is like 200 from Bangalore. There I did my engineering in electrical electronics. 4 years. It was a nice, small kind of village that time. Now a city, but yeah, quite a place. I did my engineering there, electrical electronics, and it was a good experience overall. Totally driving away from Ranchi to totally new city, not knowing the language. Uh, yeah.
And
So
Shimoga is closer to Goa and all the so-called West Coast touristy places, I guess.
So it's nearer to, I will say, Mangalore. We can go nearby, but overall we have good hill stations nearby. We have Madikere, Chikmagalur, and all, which can be covered if you start from there. It is famous for Jog Falls. I think Asia highest falls is there.
Okay. And after college, how did your and where did your career start?
So after college, I got placed in HCL Tech as a software engineer. As all the engineers of that 2008, 9, 10 batch, everyone used to go in software engineering. By luck, when I went to HCL Tech, I was into the medical device coding. That
Okay.
is where I got more of a attraction with the healthcare and life sciences domain. When you actually work with, I was working with a class 3 device, so any code which I do is going to directly impact the patient. The device was actually an automation sedation system used for endoscopy.
Okay.
You need to calculate weight, heart rate, and everything, and then decide how much anesthesia need to be given to the patient. So when you that is the initial days where I got that even a work what I am doing is going to impact life. and I got attracted to healthcare. So that 2 years in HCL Tech is what diverted me in this area. After 2 years, of course, I wanted to do something more, so I jumped to for my MBA. But I think the base was
Where did
kept in
you
the HCL.
work with HCL? Which city in India?
I was in Chennai. I was
Oh,
Chennai for 2 years.
okay.
Oh, yeah.
And then after HCL, you joined MBA where?
Yeah, so after HCL, I did join my MBA in Pilani. So
Oh,
that was a full 2 years course, of which 3 semesters were in the college, and the last semester we need to do an internship of 6 months in any of the companies. So while the summer internship, when I was in BITS Pilani, I got summer internship with Altimetric, and then I got a pre-placement offer. And after my free sem in BITS, I joined there. The work was mainly concerned around the pre-sales, more of a back end, helping with the marketing team, the clients and all. But while doing that, I also need to write a thesis, which I wrote on IoT. So comparing all the platforms. And then I came to know that Altimetric, even if it is a good company, it may not be the correct fit for me at that instant. I wanted to do a deeper dive on the different stuff. And then I jumped to from Altimetric, I jumped to my current company, HFS.
okay. And this was in which year?
So I did my MBA 2015 to 17, and in 2017 I was in Altimetric for nearly 6 months, and then I was at nearly year end I joined HFS.
Okay, great. So I think from Ranchi you went to Shimoga to Chennai. I'm sure you would have tried different cuisines, and I'm sure you would have traveled a lot also. So, which cuisine do you like, and perhaps which location as a tourist you would want to visit in the future, or maybe you want to revisit again?
So when I was in Ranchi with my parents, I used to visit, like my father was in bank, so every 4 years he used to get LTC or something to visit different places. So I visited a lot of places like Darjeeling to Rameshwaram, Kanyakumari, lot of stuff. And after being in college also, we used to go for tours. That time I visited. So overall, I think the place I want to revisit is Darjeeling. The I haven't still visited the Seven Sister States. That is still pending. I just touched the starting of Darjeeling and then I drove back. But that is one area which I want to explore more. A lot of things there to see, I feel. So yeah, that's
I think that's
also
actually really good. I mean, roads are much better in Northeast now, and in fact, like maybe a couple of years before, we drove all the way from Hyderabad to Arunachal Pradesh.
wow.
Yeah, that was a, I think 4 day long trip, and we were working with the government to set up drone flights in the place called as Sepa. It's in East Kameng and closer to
Okay,
our neighbor's border, northern neighbor's border. And that was
understood.
done during one of the Independence Day events. So I think that was
Yep.
really fantastic experience. And I also worked for 3 months in Assam, in Jorhat at Assam Kaziranga University. So I think
Okay,
it's a fantastic place. But
please.
if you are near the plains, I think you should avoid the summer months. It's extremely humid. Chennai is
Okay.
humid, but this is like 3 times or 5 times more humid than even Chennai.
Wow. Wow.
Yeah,
Yeah.
winter months are perfectly okay. In fact, it's very pleasant. But summer is not a good idea unless you are going to the hills only and not in the plains.
Got it. Okay. Okay.
Yeah.
Yeah.
So
Understood.
you've been now working in healthcare consulting since almost 2017, I guess. So it's close
Uh,
to
s-
70, 80 years.
yeah, it's close to 8 years. So when I joined HFS, I was mostly looking into different industry, not only healthcare, life sciences, and IoT. So IoT was my tech vertical, which I was looking into, and the tech horizontal and the verticals were the different industry, mostly focusing on healthcare life science, which was my all the interest from HCL. But from past 5 years, I am totally concentrated to healthcare and life sciences. So yeah, 5 years. Yep.
I think before we go to digital health, I'm kind of curious, and hopefully, people who are watching this podcast would also like to know what exactly is a consultant's job, because you kind of started as an engineer and then did MBA and then consulting. So I think this is a pathway that a lot of people are now taking up from different areas. Even I think ISB has a separate course for doctors also, and a lot of doctors and people from healthcare background are also now joining consulting. So what exactly is the job role or job profile of a consultant, and how does your daily activities go?
So for the consultant is mostly the for helping firm with solving their different IT and the business problems. So when I say IT and business problem, you can think as a tech transformation of a hospital, or a kind of evaluation of the solution what is getting prepared by the service provider like big IT companies. So those things, as a outside in perspective, we can help them what we are seeing in the market, and then we go ahead with helping them what their customer can expect from them. These most of the companies which are doing these tech transformations are more of a digital in nature, so they talk a lot of digital language, but the real trend outside is what we as a consultant, or I would more say as an advisor, help them to realize what is going in the market, how is going to impact the person health. Uh, Overall, looking at the broader picture rather than only the profits and revenue. That is what we deal here at HFS as a whole, and I my work is on the healthcare side doing the same. So that
At
is
what
so.
stage do you kind of engage with them? I mean, at a very initial stage, or is it, an existing service where you are actually called in to, provide your comments on how things can be changed? Or at what stage do you actually get in?
So, as a consultant, as and when I think you can say it, cross the value chain whenever they want to. So, they may want to consider us at the start when they are planning for the next year, and they want what kind of solution will pick up next year. So, from that stage, many of them may not kind of work with us at that stage. They will come later on, near to when they are going to launch the solution, to know their how to go to market strategy will be. So it is not that there is any fixed time when we are approached. We are approached whenever they feel there is a need of it. But we prefer to get this from the start of the thing so that we can kind of have the things in the correct shape from the starting, not coming at the last place and then yeah, asking to change the stuff. So
Yeah.
that is the way I think it works. And right now, mostly we work for US healthcare. India healthcare is still not so advanced. So there is opportunity building up. But with India healthcare, the opportunity is already what US has already covered. So
No.
that is one advantage when they come to us, because we have already seen it somewhere happening and then we can help it out.
Okay. You also mentioned that on one side these companies actually come to you, and then you have to advise, guide them, for which you need to keep yourself updated on the latest, more in the tech side, and also on how these services are actually implemented, and how does this feedback actually kind of help to advise these companies. So how does this information come to you, or how do you keep yourself updated with this?
So on the initial, on the grassroots level, when we start, it start with the book theory. So we started what is digital health, what and all we are going, but that stops at the theory level. When these company comes to us, we need to connect that theory part to what we are seeing in the market. Now to update ourselves, I think it's every day you need to go through the different articles. There are a lot many trainings nowadays. Of course, your school is one which gives a lot of information. Apart from it, I think many webinars are getting held. If I talk about Indian government, Ayushman Bharat will have a lot of webinars every 3 months time. So that I do keep a I. You do have to read the news press articles, those things, and LinkedIn is a pretty good source to learn all of it. There are a lot many similar kind of minds kind of posting the new news topics and all. But at end of the day, every news need to be converted in the parameter what I am looking into in the that business. So I need to think across how what I read or what is the news is, how it can be converted into the business opportunity. That is where I think, as a consultant or a advisor, that business mindset comes up.
And I believe you also post regularly on LinkedIn on different topics.
Yes, I am kind of weekly. I weekly post it. So yeah, that is more of a learning for me also. It helps me to be updated every weekly level and what's new happening in market. Else, if I don't post it, I won't have a kind of tendency to look into the news at so detail level. But now, as I post it, it's a learning overall. Yeah,
Thanks. I do read your postings and it's actually really good.
thank
Helps me to
you.
also update on what's happening in digital health. So, in your opinion, I mean, if we forget the present for a while, in a slightly imaginative way, how do you think digital health is going to impact people slash patients and then the providers, and maybe if we add the third part of this excuse me, equation, the payers also, how do you think it's going to impact them? It need not be what's happening in the present, but if we can just stretch our imagination in 5 years, 10 years, how is it? But we'll also like to know from your side, how is it going to be impactful in America, and slightly more challenging is how is it going to be impactful in India?
So when we talk about digital health, I think India is still lagging in that aspect compared to US for sure. US has lot many in digital health aspect and they are doing great. India needs to catch up to it, and we have a lot more opportunity than what US has. So if I think as a digital health impacting patient, provider, and payer, I think for the patient is something, it will bring convenience. It will kind of help them to relax their kind of anxiety. That is the main thing I feel, and the access. So we consider quadruple aim of care. One is health outcome. You have financial cost, you have the experience, and you have the equity and access. So I feel digital health is at end going to impact all this four, be it as a equity reaching all level of the society, the cost outcome. Digital health are mostly kind of saving the financial cost of the people from the villages and all. They can now consult the city doctors and all on teleconsultation. So that is there, and in future this will keep on increasing as and more healthcare people are coming into picture. I think full India will get connected, and that is where the overall the health of the nation as a whole can improve. On the experience aspect, you can think it's a easiness to kind of connect with the doctors. So on the, if I say for the future, I think that future holds more for the rural areas than the urban, because urban is getting their part of the share, but the rural is something which are lagging. So 10 years down the line, the equity is the main aspect which is going to get touched with these digital health. If I talk about US, they are doing great. I think with the new tech coming into picture, they will improve a lot over it, and a platform approach will come into picture, which is they are still fragmented a lot, be it a payer, provider, patient. There is a lot of fragmented ecosystem there. I think making them all in the single platform is what the future holds.
Even yesterday, I was talking to one of my ex students. He is working with the California state health systems. And apparently, the big challenge there was interoperability, and as you mentioned, different people having kind of very distributed and different health systems. And if we even take an example like a consumer product or even like something like a car, although it's all the internal combustion engine and now we have hybrids and EVs, everybody is having their own different design and different shape. I'm even wondering if interoperability, complete interoperability, will even be possible, because it's kind of human tendency to differentiate ourselves. Would there be a possibility of some kind of so-called essential interoperability? Is that something that is achievable rather than complete interoperability with everyone imagining different things?
So yeah, you mentioned correctly. It's a tough thing, and US has been trying to implement it for a long time. Still, they haven't. So yeah, there is something called essential interoperability, which will work, I feel. But still, the kind of tendencies to change is the problem which I think is people are facing there. But essential stuff need to kind of interoperable and need to get transferred that way. That is pretty important. Uh, let's see, means I have been hearing this interoperability from years, from past 5 years, from the time I have started working on it, and I haven't seen much work across it. Of course, they have achieved some level of stabilization on this, and there are some things happening that way. But there also the problem exists between urban rural. Again, it goes back into that lower ground level. If the equity of care is taken care when they are implementing the system, so need to be done something with the essential things. But I don't think fully possible. It's
Okay.
not so
Well,
easy stuff.
I think in my fairly limited personal opinion, I'm also not sure if complete interoperability would be possible unless it is one service provider providing for
Yes.
everybody, in which case there's actually no need for interoperability at all because it's one system only. Um, you have been mentioning about the digital health system. Uh, how does digital health system kind of overlay or work along with regular care itself? So if you look at regular healthcare, a person makes an appointment or walks in, meets with the doctor, and then probably he gives some advice, goes to a pharmacy or goes to a diagnostic center, or maybe he just goes home and then takes the medication. That's a very simplistic way of describing a healthcare event. How does the digital health overlays on this?
So, as per my opinion, digital health is what nowadays is forming the basic layer also, and then people are going to doctors. So all the different devices what people are having, I think it forms a ecosystem of the digital health. We nowadays have a SpO2, we have BP machine in home, even glucometer. Even if in India, even if they are not kind of approved one, people do use it a lot, and it does make its own importance to the digital healthcare ecosystem. So from there, people go into the doctor, and then from doctor, once they come back, I think for the follow-ups nowadays, a lot of hospitals, especially Apollo and all, have started using this virtual consultation.
Okay.
So this virtual consultation plus the medicines ordering, these all forms the, I think, overall gets into the picture. So I will call it a sandwich model in which the basic things happen in the home, then you have the healthcare, normal healthcare what happens, and then goes on the top post care, whatever people are using the digital activities into it. So that is the way I see it, and that is the way it should be done, I feel. uh, if I say about India, there are a lot of rush in the hospitals. To reduce that rush, there are a lot of timing issues. There is a lot of scarcity of doctors. So all these are getting solved by the different digital health stuff out there in some or other level. I won't say these are fully 100% getting used in India. We do use bits and pieces of it, but still it is impacting us a lot. So I know even you used to work going to different rural areas and then checking up the patients and then getting up the reports by drones and all. The same concept I think is going to save a lot of time. Lot many companies are doing the same. They have their own healthcare coordinators going to the different rural areas, use the digital health equipments, and then get up the report. So overall, this will solve the problem of a proper care. Plus, access will be better. The cost will be better. I feel when you get the kind of treatment in your own home, better call it home care or virtual world, people feel more confident rather than coming to hospitals.
Yeah, I think there's a lot of convenience element associated with digital services, not just healthcare, and but that's assuming they all work seamlessly. So, in your opinion, what would be the challenges in digital health?
The first challenge, what I feel, is education. So we in rural people, we do know about it to some extent, but if you go slightly outside the city, I think the education is the main, the literacy about those digital health. equipment or how to use these facilities is the gap which we need to cover it up. And that is the most important parameter right now to go to the next level. Uh, Even for urban areas, I have seen my friends who are busy with their own life. They are not aware of this digital health, different things, what they need to be using and all. So I think literacy is the one gap we need to work upon. The first one.
When you speak about literacy, I think with our limited work, uh, it's not just regular literacy because there is digital literacy. These are, you can be proficient in your local language, but the challenge is your digital health systems are not necessarily in your local language itself.
Yep.
Uh, they are probably in English at least. Most of the EHRs are in English. I have personally not seen a full fledged EHR in a regional language or a local language. And then there is digital literacy. These devices, again, they are all not the same. It requires certain skills to use these devices. And there is also another layer to it, which is the so called emotional issues. When you are sick, you are really not your best state of mind. So when you have to use these devices yourself, again there is a challenge to kind of give some substantial attention to use these devices. Also, when there is a healthcare worker, again the interaction with the emotional person on the other side, you will have to be slightly a bit disconnected and then use these devices. So I think there is a lot of steps associated even when we use the term literacy itself. And India again has a distinction of probably the only country in the world with 22 official languages, which means you have a 22x problem, not just a 1x or 2x problem compared with America. Uh, how do we address any of this? Or is anybody working on these areas to address and make it a little bit easier?
So I think if I urban, I think the kind of literacy things can be sorted out at slightly better way than the rural areas. I think digital literacy is something urban can understand more. Again, they have access to healthcare more than rural, so that I feel will help. Even if they are not in good mood, I think nearby doctors can help. But when it comes to rural, I think these bottom people who are working on Indian healthcare system, these will go to the people home and then try to sort out their problems. Now these people need to get a new talent of having more emotional connect and having more digital as well as a healthcare literacy. I have seen some few of the companies sending or the NGOs who does have a different people. They send them to villages. They do the different basic testing and then they come back. So these people are those village people only who can kind of talk in local language, who can explain them. Of course, at the end of the day, they need to know English. That is one parameter. But right now, till we get a kind of AI coming into picture, different LLMs, the local LLM language changing and all comes, we need to kind of survive with the English stuff. And we need to operate in the English language till this rural or the local language come into picture. So with these English language, one need to have the English literacy. When digital, one is the healthcare. So this three literacy for the rural side. For the urban side, uh, uh, the access to care is at a better level. Not sure. I think it's more require curiosity for the urban side to know about digital and the financial literacy rather than the anything else. The problems are lesser in this end, and the access to care if they are not feeling well is better. But on the digital health, when I talk, I mostly feel it is going to affect the lower down the order or the areas which are still not well connected more than the urban.
Okay. One more question that I want to talk to you about is the cost of digital health. I think from a consulting side, I think that would be one of the key parameters that anybody would be actually looking at when you are talking about digitization or probably digital transformation. As a percentage of service, can you put some kind of a number on how much it is going to be costing? Maybe analog service, as it is done normally, versus a digital version of the same service.
So I don't have any figure to be frank right now, because I mostly worked on the services side, so I am not sure how it is going to work that way on the infra side. But the infra is more of a one-time investment, what I feel. So once they are done, there is a recurring revenue attached to it, and then they can get over it. Uh, that is what I feel about it.
But there's also a recurring element of the cost, right? Server charges.
Yes,
If you
true.
probably compare digital health service with any other digital service like your e-commerce or a delivery service, a lot of them are substantially kind of charging 20%, 30% of the service cost as a digital kind of a component. Is that probably a fair kind of assumption that digital version will cost 20%, 30% more?
It will surely cost more than analog version. So that is there is a revenue component in it. But again, on the digital side, the economies of scale works a lot better than the analog side. So when it comes to digital, number of resource you need as a human will be less than what you use in the analog side of it. And the speed, the number of patient you have been working upon will be quite more. So I think these economics of scale will solve that challenge there. But again, as you said, the server cost and all does come into picture, and a small portion of any services need to go in that aspect. Uh, but still, overall, if I feel the calculation, it will be still be 30 to 40% less than the overall analog if I take that into consideration.
Yeah, I guess we need to not just look at cost, but also cost versus benefit. And
Mhm.
if you're able to serve more services to more people, I think eventually the costs actually come down substantially.
Yeah, yeah, true.
Okay. Um, I mean, like, what is your opinion of home-based care? Because you are basically saying that digital healthcare is going to be more convenient, and hopefully it will go beyond hospitals and even to homes. How is the home-based care actually expanding, or maybe developing in India and in America?
Sure. So there are a lot many home-based care healthcare companies coming up into picture who provide these nurses, kind of, or therapists at the home setup. The main advantage of it is people don't need to be in hospital for long. So maybe you get in 3 days, you get discharged and you come to home. You still need a nurse or a therapist to help you out, and that is where these companies are coming into picture. A handful of them in India right now. Of course, one of them is Apollo, who is doing this work, but I think it does help in a way that people are more open in their own home to take the therapies.
One second.
A kind of virtual hospital coming up into picture. So those doctors, nurses, and all are coming to home, having a virtual hospitals, and people are more comfortable in the home. That is what we are seeing. Now, if I see the other component of it, how different stuff needed, like you will have oxygen cylinder and all will come into picture. I think in India it is a lot easy, and people have started keeping oxygen cylinder post COVID. They are keeping a lot of uh, appliances or devices in the home itself. US, the same thing has been working for long. It is still in the growing trend. Maybe if I remember the figure, I think it is 6 to 7% in US, the growth of the home care base, and it is nearly 20% in India. In India, the other is the gig workforce. I think that is helping a lot in the healthcare side also, because this gig workforce need to earn more money and they are open for this kind of work. They learn the basic nurse stuff, and then there are a lot many apps who nowadays you can use and get the nurses on demand for any kind of facilities, for injections, for any therapy at a fixed charge. Pretty easy way. So this will become a kind of help to the healthcare hospitals and become a convenience layer. everything is added to. I think one thing is we Indians, we are pretty kind of think about the costing. So this is about low in cost compared to hospitals, the convenience, the access to care. These all get impacted when we are using a home based healthcare. Of course, for not all the situations it is you are going for home based, until unless it is not an emergency. I think this home based healthcare we are seeing an increment of usage.
You are mentioning about home-based care, and most of this,
Yes.
what you mentioned is follow-up care,
Yeah.
post probably
Yes.
consultation, or probably maybe post-surgery follow-up care.
Yeah.
Do you see a role of preventive care or even so-called, regular care? Usually, some of the people, not all, go for regular general checkup. So, do you see a possibility of regular general checkup and then preventive care as part of home-based care?
Can be done, but I haven't seen that trend still in India. In India, most of the demand what I have analyzed it across post operative care. So that is where these people are getting used more rather than the preventive care. There are opportunities, and there are few section of the people who does use it in that context, but I think 80 to 90% are still in this post operative care therapy. Uh, these are the main.
Okay. In US, at least, I think there is this concept of value-based care that is
Yeah.
picking up, and at least one of the focus areas of value-based care is the idea that if you prevent healthcare conditions from happening, then you won't actually have a bigger expense later in your life. So, what is your opinion of value-based care?
So I think I do have a contra view to that. Of course, it does make sense on
Okay,
theory a
I think
lot.
podcasts all welcome contra views because at least there would be two more people who can actually listen to it.
So on value-based care, I will say yes, it is pretty good on paper. The more value or better outcome you get, that value is added or as per it the payment is done when it comes to US. But how you are going to measure that value, that is the more stuff what is creating a problem. I think US has been trying this value-based care from 60 to 70 odd years. Still, we say it is picking up, but not many companies have been showing a quant outcome out of it. Means we can quantify that kind of situations. I haven't seen much. Everyone will have a theoretical parameter that we were able to do this and that, but at the end of the day, there's no specific baseline where you can measure that if this is the outcome, then this value-based care is working. Uh, at Also, if you talk about US, is still I will say the highest per capita they use on the healthcare. I think 16 to 17%, nearly $16,000 per person, and still their health outcome is not in best in the world. Even if their GDP coverage, what they do is one of the highest in the world. So it means that something is problem with value-based care. That is my personal opinion. There is no baseline from where we can kind of measure it that actually this value-based care and the payment is getting kind of working in the similar pattern. I
So
will
if
say,
you
yeah.
look at value-based care, I mean, if I kind of so-called uh, dissect your opinion, the idea of value-based care is okay, but there is no quantifiable or an operational platform to implement or deliver value-based care. Would that be a correct way of interpreting?
Uh, I kind of plus there is no measurement of how will you are you going to quantify value in the number terms. At the end of the day, that is what matters the most. So that is what I feel makes the difference.
Uh, so, will digital health actually make any difference?
So I won't connect digital health to value-based care. I will say digital health as a standalone. So when I talk about any healthcare, I will say preventive healthcare does make a difference. You do have digital healthcare making a difference. Uh, I won't wish it to merge with value-based care because again, then measurement issue will come into how much value as per that payment and all those stuff. So digital healthcare will impact uh, all the quadruple aim of care parameters. it is going to impact the cost. What I feel compared to the different individual healthcare, what are different doctors or resources wise, so their financial impact come into picture. The experience of the doctors as well as the patient does improve if we are using digital health. I haven't seen any different opinion in that. And access to care is definitely in India, like a country like India, the access to care by digital health is one of the parameters which is it's going to impact. So overall, digital health is going to impact. Now the main problem with the digital health is how you are going to combine overall from starting to the end. Means it shouldn't be standalone getting used like you are only using one of the devices or one of the solutions or services of digital health and again going to the analog connection of all these devices as a whole or digital health as a whole as a platform is required for proper impact to the society.
Okay. Maybe just probably one more way of looking at value based care is so, I mean, we come from an academic background, so I think if you look at it from a theoretical perspective, the challenge here is it's hard to quantify prevention, and
Yes.
it's even harder to so-called implement prevention also, because although the disease is kind of there's a possibility to quantify disease, and even there's also a yes or no if disease is present or not. It's very hard to kind of pinpoint and quantify what actually is the direct cause of a disease, and usually
Yes.
there are multiple causes, determinants of how a disease can actually emerge. Theoretically, what we are hoping to do is, instead of looking at healthcare as treating a disease, one possibility of looking at healthcare is also preventing a disease or maintaining what is called as a normalcy of health. The challenge here is the variation in normalcy. What is normal to you is very different from what is normal to me. And but if there is even a possibility of identifying what is an individual normal and then maintaining that person in that normal space, the potential of reducing disease is there. But again, quantifiable, how to quantify it is actually challenging. But relatively speaking, there is actually evidence to it. I mean, if you look at India versus even Singapore, they live in a similar so-called tropical areas, and malaria is more prevalent in India, not as much in Singapore. You hardly see any cases, and the reason is better infrastructure, no water stagnation. In India, it's very kind of I wouldn't call it as an opposite, but challenging to implement. So you actually see that if you kind of change the ecosystem and probably engage in so-called preventive behavior, there is a definite potential to reduce diseases. In fact, this is how most of the Western countries have much lower incidence of communicable diseases, not necessarily because they have better antibiotics and we don't have them. In fact, like India has actually better access to antibiotics. It's broadly because they have better infrastructure, which directly or even indirectly makes you less in contact with most of the determinants of communicable diseases, and which is why you actually don't have. So, if there is a measurable and a quantifiable way of controlling your immediate ecosystem, and if there is also a measurable and quantifiable way of identifying your normal and suggesting what you can do to maintain your normalcy, would that, in a very theoretical way, constitute the basis for value based care?
I think so. It should. So again, there is a concept of social determinant of health which comes into picture. Now, if I talk on Indian aspect, India is kind of struggling with that social determinant of health, and the many of the different government policies are being standalone. The social determinant of health is one which is going to kind of tie to it, and then tying that with this digital health, the new tech will make a end-to-end ecosystem. I think right now India is mostly working on the standalone part of it. Value-based care in India yes, on theoretical basis, we can try a normalcy kind of definition. But again, healthcare is hyper local in India.
Yes.
What may work for southern part of India may not work for the northern part of India. We can have a range of it, but the hyper local extent of India is one of the extreme in the world, I will say, when it comes to healthcare, and pretty tough challenge to solve it. So value based care is again something, even if we are trying to work upon it, we need to get a clear path. Rather than concentrating on value based care, why not to have use this? Of course, at the end of the day, you will call it value based care if digital health is going to impact the health outcome. But rather than giving the name of value based care, why not to take it as a preventive care, then taking care of the social determinant of health, which in turn can help with the better health outcome. So
Yeah,
that is,
that's, I mean, I think no one can disagree with the fact that there is a lot of disconnect in the way policies are designed, implemented, and even practiced in India. I think one recurring, or maybe even two recurring events that actually happen in our country is basically the floods and loss of lives, loss of livelihoods because of floods, probably extreme weather because it's not just floods anymore. Heat
yeah,
waves also come, greatly impact healthcare, but these are all external events and policies for these versus policies for healthcare. There's very little connect. And the second one is the air pollution. I think it's actually becoming a bigger issue for two,
yeah,
3 months, and then it naturally dies down, and then the next year again it actually comes up as another issue with very little connectivity between healthcare policies versus infrastructure policies, and we still don't seem to have much of a solution. So, yeah, I agree that there is a serious disconnect, but as I said, from an academic perspective, we do have some kind of a liberty to think about at least
yeah,
theoretical possibilities.
yeah.
It's actually great talking to you about home-based healthcare, digital health, and then now value-based healthcare. Uh, are there any other ways healthcare can be paid for other than insurance and out of pocket? Is there any other ways where creatively we can hopefully uh, pay for healthcare, because healthcare is expensive, and as you just said, there is a lot of called as social determinants also associated with healthcare. So, can healthcare be paid for by infrastructure or maybe by other services?
So I feel a possibility is there. Still maybe theoretical, but a lot many insurance companies, when you take the insurance nowadays, they connect to your wearables, and then they check out how many steps you are walking every day, and as per it, your premium for next year will get reduced. Now the same concept can be taken into with social determinant. If one is able to have proper education or something at that extent, the payment of the that insurance parameter can be getting deducted and the cost can get lower down. That is one theoretical concept what I can think of. Other is, of course, there is a universal coverage concept which government pays, and it is it will help out of the pocket. But overall, the out of the pocket problem in India is not because of insurance, but it is because of the liberty we have uh, of getting the access to the doctor easily. So at one side, it is pretty kind of smooth for us to go meet the doctor and all, and then get it sorted within an hour. You get the kind of you don't need to wait for them a lot compared to other countries, which does have a kind of waiting time. So this out of pocket is the fee we are giving for having that liberty or that service or that access, I will say. But how to pay for that insurance thing is theoretically social determinant of health should impact the premium values to lower down the cost of care. I can't think of any other process right now, or maybe it's not coming in the mind. But yeah, that's I can think.
Great, Mr. Mayank. As you are aware, we have started India's first school of digital health, and we are
Yeah,
offering bachelor's, master's course in digital health, medical robotics, and also immersive healthcare, and of course wearables and the devices also. There are a lot of new things that need to be taught to the students. So, in your opinion, can you probably name maybe two or three skills that need to be definitely taught to these students?
Yeah, sure. So I did look into the syllabus of your school, and it's pretty vast. I was
Yes.
pretty happy that it is starting from basics and going till the advanced level of it. So I didn't feel there are much gaps, lot of courses and all. But I think one place where everything uh, uh, becomes one is having the business value, because for any device or any healthcare service, at the end of the day, if the business is not coming out of it, no one is going to pay for it. That's the problem with Indian, or for even for universal healthcare. So a business idea or kind of tech knowledge, even if you are a doctor, you need to have a tech knowledge, digital literacy. The way AI is advancing, the that advancement need to be kind of covered up with the different extra short-term courses, I think. Plus, there should be some business courses included. So this two, I think, is the main we can add up to make the digital healthcare better in the long run. Because by the time people are coming out of college with 3 years of those knowledge, good on grassroots level, but when you join any firm or something, you need to have to show how you are going to get business out of it, or what are the different revenue generation ideas out of it. So that is one area I think schools need to look in deep. Of course, the human parameter is correct. You have the human parameter taking into consideration in the health outcome. But again, whenever the money is attached to it, the business thing is comes in picture. So yeah.
Yeah, I think we also agree with that. I mean, a lot of theoretical discussion can happen, but unless there is actually revenue, a lot of it remains theory and it actually does not turn practical. So, and that requires a separate skill set to figure out what is the value and how to probably even monetize the value, and then actually implement it and see if you are realizing the value, and that is a separate skill set in itself. You also mentioned about AI, and I think we have kind of not spoken about AI, and that is, I think, not at all right these days. So, how do you think AI is going to impact healthcare and more specifically digital health services?
So AI has been changing like every week or so. So getting updated with AI is like a different ballgame altogether. And the way it is going to impact, we need to keep updated. If you would have seen the latest news, the new AI clinic has been opened in Noida, I think, on 6th of this Jan, where they will
Yeah.
be in the government hospital. They will be kind of working with AI on the different reports and with diseases, pathology, and everything. So it is going to impact a lot if it is able to actually do what we are thinking, to be frank. Still, there is a lot of areas where we are not sure if the AI is giving the correct answer or not. But if we are able to increase the accuracy, it is kind of life changing, or it's a event of which we can change the full healthcare from the different medicines discovery to reading of the reports, to creating of the reports, to analyzing the report, helping the doctors, transcribing whatever doctor says, and act as a friend of the doctor. So overall, it will cover each and every parameter, not only digital health, but it will start from the basic level of the healthcare to the end of the life. So it has uh, it has much things which it can do, but again, we need to validate it across. There are a lot of things still in pilot. If I say, if AI can detect by the SpO2 and BP and your heart rate and all, there are a lot many things AI can detect if it has data of a lot many patients. In that case, it will really increase the speed in which the diagnosis is done, the medication is given, and what kind of medication is given. Also on the medication side, there is precision medicine coming into the picture, which kind of works as per your genetics. AI being in the market will help. to do that genetical changes sooner than what as a human doctors can do. So how much we talk about or expect AI to do, that much expectations will rise, and AI need to get over our expectations and make itself prove that actually they are going to work on it. So it's a pilot. I will say I hope it works, but still on the minor level, it is helping to analyze the reports, transcribing and all at present era. So
I
good
think
things
at
it can.
operational level and documentation, I think AI is really doing a
It's a
good
good.
job. Especially, it's probably the fastest way of documenting,
Okay, yeah,
provided the inputs are all kind of really clean and maybe already been verified. So if you have maybe typed up 2 pages, whichever way you'd want it, bullet
yeah, yeah.
points or maybe making a table, I think AI is probably best.
Yep.
But capturing those 2 pages in a very clean way, I'm not terribly sure how much AI is actually helpful. But
Yeah.
the clinical side of it, as you said, needs to be rigorously
Well,
validated. Is over probably several situations, not just a single point of validation. And I think there's still some way to go before we actually reach to maybe documentation levels of outputs from AI. Well, thanks a lot, Mr. Mayank. It's been great talking to you and hearing your views on the electronic health records, home-based care, and as you rightly said, digital health is making healthcare a lot more convenient, a lot more accessible, but it's still a substantially long way to go to implement those in India itself because of a lot of what you call divergence with regard to social determinants and also several kind of healthcare systems. And again, as you rightly mentioned, healthcare is hyper local in India, which means even at the outset you have 30 states and 30 different
yes.
I wouldn't call as forms of healthcare, but variations in the way healthcare is actually delivered, and bringing them all together is challenging. Relatively speaking, US is more simplistic compared to the extreme divergence that India has, and even there it is actually very challenging. And even if we kind of attempt to do this, the business case of it and the fact that you need to show clear value proposition and also some kind of a revenue generation potential is even more challenging. So, any kind of parting thoughts on how we can actually collaborate in the future?
So I think, of course, as a academics, you have a strong theoretical language, but I think what is going on in the industry, that is where I can help. I mean, it's like every day it's new with new every version of new LLM coming into picture. The health GPT is coming into picture. It's changing at the pace which, as an academic, it's pretty tough to change the syllabus as per it. So I think that is where we can come into.
Sounds great, Mr. Mayak. We'll definitely stay in touch and hope to probably write up some joint reports or joint research papers with you. I think that's probably something that we can try. And if you need any help from us, more than happy to support.
Sure. Thank you. Thank you, Dr. Suresh.
Thanks a lot.